I like to just do all good news, and I think medicine is where the most good news is. Dr. Gray, welcome. Great to have you on the program.
Thank you, Hugh. I appreciate it. It's wonderful to be with you this morning.
How long have you been with the Mayo Clinic?
I have been with the Mayo Clinic for 24 years. I actually started here as a surgical intern, so sort of the American dream. I began as a surgical intern, had a career as a surgical oncologist, and have more recently stepped into the CEO role in Arizona, where it's really an honor to help lead this very special place.
Now, Dr. Gray, yesterday I had lunch with a White House fellow who tells me there are 6 doctors among this White House fellows class, and I was kind of astonished unless they go into medical administration, unless they go into healthcare management systems, because that fellowship is about management. How did you prepare to lead Mayo Clinic Arizona?
You know, Mayo Clinic has a rich history of physician leadership, and we really feel that it's important that those people that are doing the work of healthcare also provide the leadership for that healthcare. We have a wonderful partnership model here at Mayo Clinic where we have administrative experts that partner with physician leaders. But our core value at Mayo Clinic has always been that the needs of the patient comes first. And we really have the philosophy that physician leadership helps us make sure that we keep the needs of the patient at the center of everything that we do.
Now, Dr. Gray, the best book I have ever read on healthcare is The Innovator's Prescription by Clayton Christensen of Harvard Business School. And he wrote it years ago before Obamacare came along. He said, everything will change in medicine in the next 25 years. That was probably 10 years ago. Is he still right?
He is still right, and we do think that a lot of the things that Mr. Christensen put forward in his book have come to be and will continue to come to be. There's a lot of shifts that are happening in healthcare, and we're seeing a lot of those paradigm shifts, but some of it hasn't come as quickly as many of us hoped and as maybe he outlined, but we are on the cusp of paradigm shifts in healthcare with the technology that's available, the vast amount of data that we're now able to process and apply things like artificial intelligence to. We're really accelerating those things. And while there's plenty of challenges in healthcare, we at Mayo Clinic are really excited about being able to apply these and in a complex field like ours, really be able to accelerate cures on behalf of patients with all of that. And not only accelerate cures, but improve our patients' experience in healthcare. If you think about the conveniences we've gained in recent years in things like the way that we bank or even how we book our travel with airlines, healthcare hasn't improved those conveniences at as rapid of a rate, and we want to put a lot of effort into that patient experience that we hold so important at Mayo Clinic as well.
Now, Dr. Gray, if you've listened to the show, and I'm flattered that you have in the past, you may have heard I've been a visitor to and speaker at the Neighborhood Christian Clinic in Phoenix, which is sort of an innovator in helping poor people get access in the community. And you're at the other end of the medical chain. The Mayo Clinic, while it serves many people who are just indigent, it's this vast network of excellence. Is there any way that those two nodules bridge? Is there some way for American healthcare to get back to the public healthcare model of the early part of the last century, plus this extraordinary model of Mayo and Cleveland Clinic and MD Anderson and USC and UCLA?
Yeah, Hugh, I think you point out something that's very important, that we have to think about the entire spectrum. And I will give you an example that our Mayo medical students in Phoenix actually spend a significant amount of their time, along with our faculty, volunteering in such clinics as you described. And Mayo Clinic really sees its mission in not just providing health care to those who walk through our door, but also facilitating the healthcare system. And while we do some of that directly, as you referred to, many millions of dollars in charity care that we provide, a lot of it is our time and effort and creating systems that allow that. But you're right that a lot of the model that has been in healthcare of service-based reimbursement, paying for a service just like any other service, has held back some of those efforts. And as we move to more value-based care in terms of our payment models, that'll be important. But I think it's important for everybody to know that Mayo Clinic and doctors and nurses really have servant hearts, and they want to be able to serve people and find a way to do this. And a lot of it is through those clinics. A lot of it is through charity care. And we want to connect with patients and make sure that everyone has access to health care that's very affordable.
I'm talking with Dr. Richard Gray, CEO of Mayo Clinic in Arizona. Now, Dr. Gray, it's the holiday season, and most people are full of good cheer, but a lot of people are sick. And people who are sick sometimes wonder if they're going to see the next year and the year beyond it. Do you ever sit around and just blue sky where healthcare is going and what medical innovation is ahead of us? Because I read the Israeli news, and you'd think that cancer was cured if you read some of the stuff that comes out of Israel. How vast of a blue sky horizon is there out there?
Well, we have made incredible progress in healthcare, and many of the challenges, I think, in U.S. healthcare is around many of the systems and helping people to navigate and access healthcare. But within the U.S. system, there are incredible cures and progress that have already occurred. But yes, we absolutely blue sky things, and again, I think applying technology allows us so many more opportunities to not only have more and innovative cures, but to have ways of preventing health problems and disseminating those to more people. I'll give you an example of our cardiologists have much data from EKGs, kind of an electrical tracing of your heart, and a relatively common test that many of your listeners have probably had. But a very dangerous aspect of heart disease is heart failure, where the heart doesn't pump well enough to get the blood and oxygen around to where it needs to be. And that is diagnosed on a less common test called an echocardiogram or an ultrasound of the heart. Using artificial intelligence and machine learning, taking vast amounts of data within Mayo Clinic, our cardiologists were able to determine algorithms from that common EKG test that can help indicate who is at risk for heart failure before they ever manifest any symptom.
Wow.
So applying that kind of technology and then being able to disseminate that widely is just one example that shows how the technological innovations that we now have can help diagnose things earlier, provide interventions earlier that can really improve health. And again, that's just one example of many of how we can do this. And then those types of innovations can be spread widely through digital means now to help more and more people, as we were talking about, to access that kind of expertise.
Last question, Dr. Gray. I spend a lot of time this time of the year helping Salvation Army because they take care of people who are addicted. And we are in the middle of an opioid epidemic that claimed 70,000 lives 2 years ago. I think it's slightly down this year. Is there a breakthrough in addiction science ahead? Is there some way, I mean, this is beyond the AIDS epidemic in many ways that you're dealing with. I'm sure you're dealing with it at the Mayo Clinic. What's ahead in addiction studies?
So there are a lot of innovations happening in addiction studies. Behavioral issues, including addiction, are some of the most difficult issues to have breakthroughs on. A lot of our work in terms of, and Mayo Clinic has truly been leading, and particularly even statewide programs at our locations in Arizona, Florida, and Minnesota in addressing the opioid crisis. Right now, we're addressing that by lowering the risk in many cases in terms of how doctors and patients interact on opioids, because unfortunately, many people do either become addicted to opioids through a legitimate prescription as a starting point, or gain those medications from someone else. And so programs to match the right amount of opioids to the right patient in the right way and use non-opioid interventions are really important. And that's been an early focus to decrease the risk of addiction in this incredible crisis that we're seeing. But in addiction science, not just opioids, but other issues, There's a lot of work being done, but there is a lot of work still to go. But it's very important to us and to our country.
Last question, Dr. Gray. In Alzheimer's and dementia studies, you're in Arizona. It's an older population than a lot of places, although my friend Doug Ducey likes to point out how vibrant the economy is. A lot of people are concerned that we'll never get there. Are we ever going to get there?
We will get there. I am an optimist, and we continue to have breakthroughs. And I think Governor Ducey would actually like to point out that Maricopa County, the county in which we sit here at Mayo Clinic, is actually younger than the national average. But
yes,
you're
he
right.
would.
We have an aging population. We have more people that are at risk for dementia and Alzheimer's specifically. But we are discovering more and more some of the causes and underlying mechanisms. And I did have a patient recently ask me that very question: why haven't we cured this yet? And the answer is that we find as we dig further into this, even as we learn more, that there are more pieces to this very complex puzzle. But the fact is that the puzzle pieces will get put together. We don't have all of the pieces in place yet, but we have many of them there. And I'm very optimistic of the track that we're on to provide a lot of hope for those that are facing this disease, and a lot of hope for those that are aging and hoping to not have to face this disease in the future.
Great place to end. Dr. Richard Gray, thank you for joining me, the CEO of Mayo Clinic, Arizona. Some good news for everyone out there. A medicine in America. There's never been a better time ever to be in need of medical services in America than right now because of places like the Mayo Clinic.